Okay, I think you might have to help me in terms of finding it and stuff when we get back.
There's some reason why it's not up on that screen.
I think he's figuring that out next. Oh. I have paper copies of everything too, so. I would probably hand those out. Okay. Yeah, we'll get to them as we go through the individual ones. As we go through them. Thomas, now that I think about it, I might not be able to make this work without doing it. That's also that.
So for those of you who just recently walked in, I apologize for the delay. We were informed that this meeting was supposed to be in June at the same time. So they were scrambling to find another. I appreciate that. So welcome. I would like to quickly do some introductions.
Talking the microphone, the people down the line won't be.
Sure. So thank you, everybody, for joining us. I would like to just quickly do some introductions. We'll start with those who are physically present, but then I also want to be able to document who is attending remotely. So I'm Melissa with Human Services. I'm the supervisor of the Family and Community Services Unit. One of the programs that I oversee is the transportation program. Lynn, I could just introduce yourself.
Oh. Lynn, I work for transportation and I'm doing minutes.
Jeff H.U.Y.L. Bay Lake Regional Planning Commission. Chris Garcia, Bay Lake Regional Planning Commission.
And the County Board.
Cody Vandervest with Human Services.
Tracy Nolenberg, Kiwani County Emergency Management.
Joanne Lasansky, Kiwani County Board, and I'm also a driver.
Dan Boyd, Luxembourg trustee.
Robert Stearns, County Veteran Service Officer.
Jean Robinson, transportation driver. Lori Bushy, transportation coordinator.
And I'm going to sneak over and
just can't hear those people.
Can people who are joining us remotely introduce themselves, please?
Good morning, everyone. This is Pam Bush with the County of Door.
Wendy Hutter, 80 the Lakeshore.
looks like we also have Tim Gilson. It looks like he's
Hi, everybody. I'm sorry to interrupt. Can you hear me okay? This is Pam.
We can hear you.
Okay. I can barely hear when you guys talk, so I don't know if there's like a speaker you're passing around or something, but I have my volume totally on high and I can barely hear anything except like distant voices.
everybody will just have to be careful to speak into the microphone. So don't I am also showing a Mackenzie Schultz. Can you speak into the microphone and ask if you're on?
I also cannot
Lindsay, are
hear
you on?
anything.
I'm speaking into the mic here at the meeting. Can people hear me remotely or no?
Jeff, I could hear that loud and clear. That was perfect.
Okay, thank you. Candace, can you introduce yourself?
I'm Candace Hunneman and I'm with East Shore Industries.
Okay, Lynn, were you able to document everybody? Okay, thank you.
Okay, again, thank you everybody for joining us. I am going to just start the meeting, but this meeting is being held in conjunction with the coordination assessment with the Bay Lake Regional Committee. Jeff, do you want to just give a basic overview of the process for today?
Yeah, basically what we're going to do, this plan gets developed every 4 years, and we've had some amendments in between too. Basically, the items that come out of this process, we put together kind of an action plan that shows items that in 5 different areas of transportation coordination that are done well and can be done better. We put together a list to that effect, and I will be passing out what we did 4 years ago for reference purposes. And that'll probably take the biggest part of the meeting. We've also developed an action plan summary working with Kiwani County's Health and Human Services staff and with East Shore Industries. We'll be passing that out and reviewing that and see if there are any adjustments that need to be made to that. And then finally, there's a program of projects that the county and East Shore Industries help develop where they're primarily looking at obtaining vehicles over the next 5 years, and we have a list of those. Remember, this is a very fluid process. This plan will be submitted to WISDOT in the near future once it's developed and reviewed. However, it is very, very fluid. I think last time with Kiwani County, we went through 4 amendments from 2016 through last year. So it's not set in stone just because it's approved today. We come back to this group and propose and have amendments whenever the county or whenever East Shore Industries or any other entity that may be looking at Section 5310 funds may be desiring those. So and want to make some changes to the program. So any questions? Okay.
All right, since we're holding that meeting in conjunction with our typical transportation coordinating meeting, what I'm planning to do is just go over some basic updates from the transportation program so that you can become aware of how essentially COVID has been impacting our transportation program. So I'll start with that, and then we'll have Jeff take over and guide us through the coordination assessment process. So just, I always provide some numbers to compare last year with.
Sorry to interrupt, but I don't know who's speaking, but I can't hear the person at all. I just can barely hear who's speaking.
Green and. All right. It sounds like you can hear me better now.
That's better.
Okay. So I'm just going to review the numbers served by the transportation program January through August, comparing 2019 numbers to 2020. So as expected, because of COVID, our numbers have drastically decreased. The program had to shut down for a short time because there was concern about how COVID was going to impact our drivers, many of which are vulnerable, and then of course our consumers that we serve and transport. So for the volunteer driver or driver escort program, in 2019, for January through August, we had provided 1,746 rides, and in 2020, for those same months, we're at 913. The grant vans, which transport individuals who may need wheelchair transport, but we also transport individuals who don't have mobility concerns in those vans as well. So last year we were at 930, and this year we're at 411. For the Algoma bus, which is running Monday, had been running Monday, Wednesday, Friday, from 10 till 2. Last year's numbers were at 713, and this year's at 379. And then the Kiwani van, which is tagged as the large old van that transports several people. It's our largest van that can transport the most people. Last year we had provided 359 rides, and this year we're at 100. So in general, just summarizing, we are at a negative 731 in comparison to last year. And of course, that direct link is due to COVID. I wanted to just update you on how the program how everything played out with regard to COVID. So again, initially the program was shut down because of the concern of how it would impact the drivers and the consumers. When the county reopened, our unit began to discuss processes and procedures that needed to be in place in order to safely reopen. We consulted with public health to come up with guidelines for transport for both the drivers and the riders. All of the volunteer drivers were trained on the new COVID precautions. The drivers were provided with necessary PPE and disinfectant supplies. The drivers and riders are screened for symptoms and exposure a couple days prior to the scheduled ride, and then the driver also does another screening upon pickup. We have implemented and strongly encouraged staggered seating. So with the driver in the front and one passenger, we're encouraging that they be diagonal in the vehicle so that they are as far away as possible. And we're trying to just do one rider per trip. The exception there, of course, would be if somebody needs an attendant and there's somebody in their family member is able to assist during transport, then they are allowed to ride along. So many of our drivers were very reluctant initially to resume driving, and many still continue to be reluctant, which is understandable. So we've had to really prioritize the ride requests. So we followed guidelines or handbook, which indicates that we'll prioritize medical, nutrition to get to grocery store, work, and then everything else falls after that. We're trying to stick close to home. We're avoiding out-of-county transports if at all possible. And just in summer, everybody's been cooperating really well. Both the drivers and the riders have been impressed with everybody's level of cooperation and our ability to resume rides, but just on a much lower level. Does anybody have questions about our COVID response? Lori, anything to add that I missed?
We've lost 4 drivers completely, for sure.
So I'm not sure if everybody could hear that, but Lori just said 4 of our drivers backed out completely due to COVID. So they just were uncomfortable because of their vulnerabilities. Anything else, Lori? Yep, thank you for reminding me of that. So the Algoma bus had been running Monday, Wednesday, Friday. We cut out Mondays because the ride levels were so low. And that is a paid driver who assists with that transport. So when we're looking at the what's the most cost effective and being stewards of taxpayer dollars, it seemed that that was the best move. There's full intention of bumping that back up to the Monday, Wednesday, Friday when ride requests increase. Anything else? Okay, just a couple other updates. So we have received approval for the 5310 grant request that we had submitted. This isn't new news. At our last committee meeting, we had talked about that and just the timeline. So we still do not have that vehicle. It's expected that probably early in 2021 is when that vehicle will actually be present and able for us to use. And then the 8521 is the grant application that we submit annually to secure funding to support our transportation program. So that grant application has been released, and we'll be working to get everything together over the next several weeks. The submission final date is December 14th. So we'll be looking to schedule our next committee meeting prior to that and in conjunction with a public hearing to review that application and get everything submitted on time. And then one other piece of sad news that I wanted to share with you as committee members, Elizabeth Wilson, who was one of our committee members on the transportation program, had passed away on August 26th. She truly is one of the sweetest people I've ever met, and we'll certainly miss her enthusiasm. So I do have a card for us to just sign. I'll send that around after for anybody who knew her. We'll send it to her family. Any other questions or comments for me? Okay, I'll pass it over to you, Jeff.
Okay, thanks, Melissa. I'm going to start the county coordination assessment exercise. Before we do, though, I wanted to pass out, we're talking about kind of our transportation inventory portions of our coordinated transportation plan. Thanks.
Right. I saw you out running this morning.
And I'm not going to go through this in any level of detail, but if anybody has questions on this later on, I will certainly be happy to make adjustments to this. But we've written kind of 3 background chapters of this plan already. Thank you. We have kind of an introductory chapter. It talks about the Coordinated Public Transit Human Services Transportation Plan requirement. And I did share my screen for those who are joining remotely. Hopefully you were able to see this. We will incorporate those who attended this meeting either in person or virtually in the meeting record on the page 2 of Chapter 1. Chapter 2 is a demographic analysis where we discuss persons with disabilities, and we talk about the 65 and older population in Table 3. And then we talk about median household income and low income households within the county as well. And then Chapter 3, we talk about transportation providers in the county, and we talk about the county's various programs. And we discuss East Shore Industries programs. We talk about MTM, the non-emergency medical transportation broker, a few other programs, American Cancer Society, Disabled American Veterans, Kiwani County Veteran Service Office, nursing homes. Then we have a list of private transportation providers within the county that we're aware of. So that's basically the kind of the background information. Just kind of review it, and if anybody has any edits to that, definitely let us know. Coordinated public transit plan, the framework for action. I'm pulling up the portions of the action plan that we discussed last time we met to develop the full plan in 2016. I have a handout on that as well.
While we're waiting on that to be passed out, I'm wondering if anybody has input on the private transportation providers that are listed on page 8. Does anybody know if, for example, any of those are no longer in business?
So this is Pam Bush. I'm logged into a county meeting on my computer and phone on this one, so I don't see the page that you're all looking at. But there was a new provider called Trueway Transport that started on September 7th, and they travel in the multi-county areas. They are wheelchair and stretcher accessible. So if you need that information to include into your provider info, Melissa, I can send that to you.
Yeah, if you could go ahead and do that, Pam. We'll also need their address and phone number and the type of service that they provide.
Absolutely. I'll send what I know about them.
Okay, thank you.
Yep.
Yeah, whoever wants them. Chris is going to pass around pens for those who need them, and also note cards for anybody who wants to write things down for this coordinated transportation exercise. Basically, what we're going to do, there's kind of 5 sections that we're looking at. The first section is called Making Things Happen by Working Together. This addresses issues related to coordination, formal program goals and objectives, and most importantly, the need to articulate a vision for the provision of services to the elderly and disabled in Kiwani County. We look at what's done well and done better in all these 5 sections. Turning to page 14 of the handout, taking stock of community needs and moving forward. This addresses issues involving service assessment and review and inventory of services provided, which are essential in identifying gaps, needs, and duplication of services. And then section 3, putting customers first. This addresses the ease of access to information about the transportation services provided in the county. Section 4, adapting funding for greater mobility. This addresses identification about accounting procedures that create customer-friendly payment systems while maintaining consistent reporting and accounting procedures across programs. And then finally, moving people efficiently. This addresses centralized managerial systems to coordinate highly diverse multimodal service provision. So if you can take a few minutes and review what's done well and done better in each of these areas. And then what we'll do, you can write notes in terms of anything you'd want to add in terms of what's done well or can be done better. And Chris is going to jot those down. I think we'll go through the list that we have here and see if we want to keep or delete anything. And we'll decide that on the items that are bulleted, and then we'll go to any additions, if that's okay. Is that fair enough? Okay. So the first item we have there is under section 1, making things happen by working together. Items that are done well. We had quite a list last time, and I'm going to turn back to that page. Under done well, we had the Kiwani County Transportation Coordinating Committee meets quarterly. I know one quarter was skipped because of COVID probably, but that's a rare exception. It does a good job discussing transportation coordination issues. Is that, do people agree that we should continue to include that bullet?
Yes, yes.
Okay, so I'll put a check there. We're including it. Second bullet, the Kiwani County Human Service Department's Family and Community Services Unit has done a good job of referring medical assistance or MA transportation requests to the statewide broker, known as MTM at this point.
Yeah.
I mean, staff would probably know more about, whether that's occurring in reality and things like that. I'm assuming it is.
Certainly it's occurring. Not new news to you, Jeff, but certainly, there continues to be the frustration in working with MTM and the struggles of consumers being able to actually access transportation through MTM. This is not a Kiwani County issue. This is a statewide issue. But we do continue to make those referrals and advocate for our consumers when they're struggling to access that transportation.
Okay, thank you. And for those of you who don't know, and I'm sure you've talked about it at previous meetings, but it looks like the state wants to award the broker contract to a different company now. But it looks like there's going to be kind of a dogfight about that. I think MTM wants to keep the contract, and they're appealing and things. I think it's a company called Vivo or something like that, or
Something like that.
yeah. So I think they're helping the Green Bay area with some of their transportation right now. So I think they have a little better reputation than MTM, but don't quote me on that. But
we discussed it at our last transportation coordinating meeting when I saw that news break. And from what I read, that appeal process can take an extensive amount of time, like over a year.
oh yeah, and there could be lawsuits and everything.
So it sounds like we'll be stuck with MTM for some time.
It could be a mess for a little bit, yeah, but hopefully everything works out.
I don't know if this is the time to mention it, but I was just told by Door County Hospital when I had to go pick up a client that was left there by MTM, that when clients request rides from MTM, they have to request 2 rides, one to get there and one to get home. And that's why clients are being left. That's what I was told.
which if you have kind of unforeseen circumstances at a hospital or whatever, if you don't know your dismissal time or date or whatever, because things could go longer than you anticipate, it becomes kind of a mess.
Exactly.
And I think there is an assumption that when you're making a ride request, that it will be round trip. So that's throwing some people off, I believe.
Anything else on the second bullet? Okay, the third bullet, Family and Community Services Unit leadership and staff is committed to providing cost-efficient, dependable, and comprehensive service. Anybody disagree with that? Fourth bullet, Kiwani County has involved public and private service agencies and providers as plans are developed and decisions are made, including collaboratively working on various planning and programming issues. That's kind of what we're doing here today. With all the private providers were invited. Anything on this? Keep it? Okay. Next, Kiwani County is focused on increasing service to populations outside the elderly, such as developmentally, physically, and behaviorally disabled populations.
I feel that one definitely needs to stay. That's one area that we've certainly made a great deal of progress on.
Okay. Next, Kiwani County has good collaboration with family care managed care organizations, including Care Wisconsin and the Lakeland Care District.
Just take Care Wisconsin out because there's no more Care Wisconsin.
Good catch.
Strike Care Wisconsin.
They closed. It's just Lakeland.
There's a second one, but the name is escaping me. Jody, do you know?
Oh, there's Iris.
Inclusa. Thank you.
Oh, Inclusa.
What's it called?
Inclusa.
INCLUSA.
Correct.
Okay.
And you,
Looks like you're looking it up when you get something. Maybe you can confirm that.
you certainly could add Iris as well.
Okay. Is Iris an MCO though, or is it more like a philosophy or a program?
It's an alternate program other than family care. So it's family care or Iris.
Okay.
Yes, it is included. Inclusa.
Okay, thank you. Where are they out of?
Green Bay.
Okay, thanks. Next, Kiwani County has improved transportation services beyond city and county boundaries.
Yes.
And finally, Kiwani County has established memoranda of understanding with assisted living facilities and nursing homes so that their residents have adequate transportation.
We certainly continue to do this, but we're seeing a decrease in their request to partner with us.
They're trying to keep them safe inside their facilities or something?
Outside of COVID, even,
Yeah.
they haven't really participated in utilizing our vehicles.
Okay. You want to keep this then, or?
I don't know that there's anything we can do to improve that, so I'm not sure we would need to go anywhere else, but
Okay.
I don't have a strong opinion.
Okay. So just kind of leave it lay then for now, or? Okay. Is there anything else that's been done well that anybody'd want to add to the list?
My only thought is the bullet point that focuses on increasing services to populations outside of the elderly, if we could include children.
Oh, within a bullet?
Yeah. That would be
Okay.
good.
Maybe you don't have to do this. We'll include it within that parentheses,
Sure.
like as well as children. Okay. Okay. Anything else? Okay, under do better, we have looked at opportunities to increase transportation options within the villages of Luxembourg and Casco and the city of Kiwani.
Dan, it's great that you're here.
Yeah.
So this is something that our program has attempted to do. Jody helped me out with some of the history, but within the village of Luxembourg and Casco, Lori as well, you know some of this history, but we haven't had success in getting much traction with it. Lori, do you have feedback on some of the reasons that you think that's been a struggle, or?
We've done several surveys, and a lot of people say they want to do it, but when it actually comes down to it, they shy away. I'm not sure if it's because they're afraid to ask for help. Luxembourg has been, we've been picking up people more and bringing them to like the doctor or the IGA post office thing.
So they're being served through the driver escort program. It's just not a separate program like we have in Algoma.
Well, there was, and before I came to this committee, I wasn't looking too much aware of it, but there is two vans in Luxembourg. One I believe is Abby.
Abby vans?
Yeah, and another one I think is Angels of something.
Arms of Angels?
Okay, I see that those two vans is moving around in Luxembourg now lately, and like I said, I didn't pay too much attention to it, but now I can focus more on it and ask them more questions, and and see what they do.
So Arms of Angels actually came aboard last year, near the end of the fiscal year. They provide services for our veterans through DAV.
Okay.
So the rides that need to go to the Green Bay Clinic, they do a lot of the appointment rides for them once they're on the transportation list for the VA itself.
And then I'm guessing for Abby vans, they're likely connected with family care. So,
Like I said, I don't know. I wasn't paying too much attention to them, but I know that they're around, and I see them pass once in a while and going to different places. But I didn't know what their affiliation was in Luxembourg. I know that Fiscal Industries was picking up, and Infinity Care is there and takes some disabled people around. But that's the first time I saw these two vans. And
are you getting much feedback from the residents within the village of a need for increased transportation options?
not really. I guess if you don't bring it up, they don't say anything. And it wasn't ever brought up to any of our meetings. And
I guess where we're getting at with this is certainly it's something we could do better. So I think it's appropriate to remain on there, and maybe we could work together to potentially do more outreach with your connection if possible to see if there's something we can.
I also, I'm the head of the Knights of Columbus too, and there's different entities that I can get out and let people know about this. And like I said, until I sat down and listened to you people talking, I didn't know anything about it. So
thanks for your feedback.
Are the correct communities listed? Obviously, we've talked about Luxembourg, but what about Casco and City Kiwani?
Yeah.
Okay. The other item is listed as do better, is better educate the public that county transportation services are available.
Leave it on.
Leave it on, okay. Anything else that can be done better? Going once, going twice? Okay.
I'll throw it out there. I mean, based off of Dan's comment, maybe just promoting it more, making the awareness. If we've got those different services rumbling around in the villages, maybe we have people that aren't even aware that this is available to them. So maybe just increase outreach.
I'll include it as an item with that because it's kind of related.
with the second bullet point?
Yeah.
This is
Separate?
Candy from
The
East
second
Shore.
one? Go ahead.
And we've been talking about this too. There is some, and not sure how to address it, but like maybe after hours transportation. And I'm not sure what the county provides exactly, but we know that we run into that sometimes with individuals that maybe have a job and don't have transportation and don't have someone to get them to and from work outside of, that 9 to 5 or 8 to 4 world. So that is something that I'm not sure if that needs to be added, but just curious if the county even has something like that.
We don't currently.
Are you saying some of your clients get sent to places where they're beginning or ending jobs after the traditional hours, or?
Correct. And in most cases, I mean, we have resources, and families are pretty good about it, but every once in a while you'll get somebody that just doesn't have that resource available to them. And it's trying to set that up to figure out a way to make that happen so they can get a job in the community.
Okay. Anything else that can be done better? Okay. Turning to section 2. Taking stock of community needs and moving forward. The items that were listed last time as being done well. Says all public and private transportation providers in Kiwani County and adjacent counties are contacted when applying for Section 5310 funds. Section 5310 is the federal program that gets vehicles to Kiwani County and also to nonprofits like East Shore Industries. It can also be used for mobility management programs in counties as well. Anything on this?
We continue to adhere to that requirement, so I think that it's in a good spot.
Okay. And the second bullet was listed as done well. The transportation program has effectively identified transportation gaps, needs, and duplication of services. And then we put in parentheses here, in collaboration with the social work program at UW Green Bay. I don't know if that was kind of a one-time thing or if some of this continues.
No, that's aging itself. I think that can be removed.
Struck? Okay.
Mm-hmm.
Anything else that's done well that you'd like to add in this area of service assessment, review and inventory of services, identifying gaps, needs, and duplication of services?
One thing that I'm thinking about is Lori always does a really nice job of helping us to participate in the Aging and Disability Resource Fair. And due to COVID, that's not going to be happening this year, but I think that, I'm not sure if that falls into this section, but it's a nice opportunity to really connect with community members to get a good grasp on transportation needs.
Okay, we've added that. Anything else that is done well under this area?
At Section 5310 for funds, I don't know, and maybe these people from Luxembourg that do this are aware of it or not, but is there a way to make them aware of it by contacting somebody? Or maybe, I don't know if they do or not, maybe they know everything already.
No, so the 5310 grant, it's grant funding to support the purchase of vehicles. That's how we historically have accessed and utilized that funding. So the village is notified when we are attempting, or when we're applying to seek additional funding. I'm not sure, would there be a reason to publicize that more, Jeff?
It'd have to be, we'd have to become aware of like the nonprofit existence of an entity within the village. Say if you like some communities, like in the past, way down Manitowoc County, Keel through like a senior club had a van or something that ran around the village or the city down there, provided service. If you guys went into something like that, you might be eligible for this as well. Or if you had a nonprofit that decided to start up like a program, they might be eligible for the van like East Shore is, so.
Okay.
Those would be circumstances that you might want to keep your eye out for. There are small communities sometimes that get into this stuff. Also, there's, I don't know, I think Luxembourg might be a little small for it, but there are small cities that do like a shared ride taxi, that they might be able to get vehicles for that type of service. And then also they could get funding from the DOT for a share to cover that. I know the small Wisconsin community my son lives in, population 4,500, it's called Mauston in Juneau County. They have vans that run around and they like between 7 a.m. and 10 p.m. and provide shared ride taxi. Marinette has something like that, but I don't know if you're at the population threshold where you'd be looking at something like that or not. It's
Not really. We're only at about 2,600.
Yep.
So,
yeah. So I didn't think you were probably big enough, but it's something that's out there. It's available, and there may be communities of your size that are doing it around the state. But you just have to gauge the interest if there is any, or demand, or whatnot for something like that. So,
is there a website to go on, or contact somebody?
Once you come up after the meeting and give me your email address, and I'll send you a link to something. And I'll just jot it down after the meeting. And
okay.
That. So, yeah. Okay.
Thank you.
Thanks. Anything else under done well under section 2? Under do better, we kind of had a continuation of the theme from section 1. Determine whether transportation services can be expanded into the villages of Luxembourg and Casco in the city of Kiwani. Thoughts on this? And we're looking the next 5 years. I don't know.
I think that continues to be appropriate.
Okay, we'll continue that. Anything else that can be done better in this area? Okay, section 3, putting customers first. This addresses the ease of access to information about the transportation services provided in Kiwani County. Last time items that were done well. Fares are reasonable and affordable given the high costs of the service provided. What do people think of that?
It's appropriate.
Okay. Volunteer drivers are doing an excellent job. I'm sure they are.
Certainly.
Driver training is available.
Yes.
Home visit assessments are made.
I think you may want to note that the home visit assessments are made timely. I think Jody does a really nice job of following through really promptly when there's a request.
Are made in a timely manner.
Sure. Yep.
Okay. And we had 2 new ones last time. Kiwani County has done a good job maintaining an adequate pool of volunteer drivers. I know we just had this report, but I don't know how you want to.
COVID's got a lot to do with right now. I mean,
Yeah.
There's no place for me to go and advocate to get more drivers, and drivers are afraid of their own health.
Yeah.
Should we move that down to do better at this point?
Or we could rephrase it and say under normal circumstances or something like that.
Yeah, I mean, hopefully this will die down and then we can be back up and running full speed.
Yeah.
Well, just as we were reflecting of our current situation, Because if it's reflecting our current situation, we should move it down to do better.
I'm good with that. I think even outside of COVID, that's something we continually strive to improve on. Certainly not an easy feat in our community.
No.
Okay, moving it down there. So I'm calling it do a better job maintaining an adequate pool of volunteer drivers. And then we'll strike that. And then finally, Kiwani County offers client diversity training for its drivers.
This has been a focus for our trainings for drivers, especially since we have really sought to expand transportation to those outside of the elderly population. So, for example, some of the training that we've done is on mental health needs, serving children with special needs. There was one training in which we focused more specifically on alcohol and other drug issues, physical health needs. So we've done quite a gamut there.
Okay. Anything else that's been done well that you'd want to add?
I wonder if there's anything you can put in, since this is about putting customers first. I know all the drivers go really above and beyond to make this a special day, a special experience for wherever they're taking the client, and they've developed a really good rapport with the client. So if there's something could be put in that, you know, the drivers are make this
they go above and
develop
beyond.
a relationship, make this a special experience for the person. Because I know everybody does that, and the people I drive tell me about the other drivers they have, and it's really commendable. So
I agree.
Drivers make the transportation experience special for their passengers, customers.
something like that. It's not that, you know, we don't just sit there and drive and we're just taking them there and drop them off like they're a piece of whatever. It's you know, you develop a rapport with the people. So.
Okay, I've added that. Drivers make the transportation experience special for their customers. And I know if there's a conscientiousness about that from the management and that too. It's been talked about at previous meetings we've been at here, and many of you have been there as well. So you know, it's taken very, very seriously. Anything else under done well, under section 3? Items that can be done better. We had look at expanding existing services that are available. Yes, no.
I think that has to just stay there.
Okay. Second, offer better outreach to the Hispanic population in Kiwani County. This was put in the 2016 plan.
The question becomes, have we made any headway towards that?
What's that?
Have we made any headway towards that?
That's why I'm struggling with how to move forward with that. I think there continues to be a need. I haven't heard that there is a great need, but we certainly can continue to make that outreach.
I have a question. So if you do that outreach for, let's say, the Hispanic community, are the drivers then going to be able to communicate if they have a Hispanic individual that has limited English?
We've made it work.
Okay.
I have a client I've driven a number of times who had very little English, but I do speak some Spanish, so we were able to communicate somewhat, but I know he's driven with people who don't speak any Spanish, so. I've
been kind of hearing informally too that have one of my wife's former colleagues is teaching over at Luxembourg Casco, and I think they're seeing increased enrollment there too. I don't know about the other districts in the county, but
It certainly is countywide.
yeah. So we'll keep that. Administer customer satisfaction surveys. Has that been done where it could get moved up, or do we keep it where it is, or?
I don't think we've followed through on that.
Okay.
It probably would be good to keep that on there, and then maybe we could add a driver satisfaction survey, so we can also see what our drivers are feeling as well.
Administer driver satisfaction surveys and administer customer satisfaction surveys. And then we had do a better job maintaining an adequate pool of volunteer drivers. Anything else under do better in this section? Okay, next, adapting funding for greater mobility. So items that are done well, passenger co-payments have been kept reasonable. Does that sound fair?
Yes. For those of you who aren't aware, the copay request for round trip is $5 within the city or village, $10 within the county, and then $20 to the surrounding counties. And then for the Algoma bus is $1 per trip. I have not received any negative feedback on that. I feel like that's extremely reasonable, especially in comparison to what people are paying privately.
So we can keep this bullet?
And just another note, we're always more than willing to waive or reduce the copay if it's indicated that there's a struggle.
Are they going to try to get it where it's invoiced instead of?
Yep, I think that's in here. I remember seeing that, and we have also made strides with that. Lynn is doing a whole lot of invoicing, and we found that the consumers appreciate that, and Lynn appreciates it too. It just makes the whole billing process a little easier for everybody.
Are there any cash security issues that you hear in other places where drivers feel nervous having cash on their person when collecting fares or anything like that, or not really?
Not really. It's the wind that takes it. You've got to run after it.
Okay. Okay. So we'll keep the first bullet. Second, bus tickets or passes are available in lieu of carrying cash to pay for rides.
Yes.
Keep that. Next, prepayment options for passengers have been good. Managed care organization payments, invoicing, etc.
Yes.
Okay. And the last one we had in this area was Kiwani County can waive a payment when a customer is unable to pay.
Yes.
Okay. Anything else that's done well in this area? Okay, do better. Better explain the invoicing option to customers.
I think we could move that up to well, because Jody's been doing a really good job of telling the people as they've been coming on.
Yes, she includes that in part of the assessment process. So I agree. Can we move that?
Okay. Anything else that can be done better in this area? Finally, section 5, moving people efficiently. This addresses centralized managerial systems, coordinate highly diverse multimodal service provision. The one item we had that was done well in this area, and I don't know, things kind of fall off when you get toward the end of these sections, probably because people are tired or whatever, but the one item we had was done well in this area was there is good communication between riders, drivers, and office staff.
I believe that's still true.
Okay. And items that can be done better, what was listed last time was explore the possibility of a mobility management project that benefits Kiwani County.
We have not moved forward with that, and that's something I'm still open to exploring. Door County has offered to be a resource as we move forward with exploring that, so I think that can stay.
You're kind of, I don't know, I don't want to say surrounded. I don't know Brown County's situation very well, but you got Door to the north and Manitowoc to the south, and they both have mobility managers. So you've got resources on both ends. So you want to keep it?
Yeah.
Okay. Anything else done well or do better in this area of moving people efficiently that anybody wants to add? Okay. And then any other discussion that people would like to make note of here?
Can we go back to, if we go back to moving people efficiently, the done well outside of COVID, Lori does a remarkable job in combining rides for efficiency and just really helping with financially. Doesn't apply to COVID at all, but.
No, but you're absolutely right, and actually that is a result of struggling to find more volunteers. So she has worked tirelessly to try and combine multiple rides to get everybody where they need to be without use of too many drivers.
I want to hear the rest of your statement. I mentioned combining rides, but you added some more words to that I want to make sure that I heard.
For efficiency and financial benefit or something like that, maybe. Just simple, they'll know what that means.
So I put something, and this could be shuffled around, but there's great efficiency in combining rides for the financial benefit of the county. And I put in parentheses, at least pre-COVID. Anybody want to tweak that, or? Chris doesn't have much to do today, but I think it's easier doing it this way than the board with the remote thing we got going here. So, yes.
Under that one, maybe this would apply, it went to this bullet point to this category, but I think to give some credit as far as to the drivers, that they adhere to safety requirements and you know, what do you want to say, safety measures. We've never had any issues here in some counties and communities where somebody gets into an accident or some poor passenger lost, so they weren't properly, you know, fastened, things of that nature. But, you know, identifying the attention to detail to the drivers, you know, as far as being able to do all these in a safe manner.
And we certainly appreciate you presenting at some of our driver meetings to just have that feedback regularly. And in addition to the driving safety, I think perhaps we should include the safety measures connected to COVID. They've been, both the drivers and the riders have done a great job of adhering to those measures to keep everybody safe.
So we want to wordsmith that one.
You want to have 2 separate ones or one?
Do you think they both fit there?
There really wasn't anything relative to safety in any of them, so I just don't know if that's where you want to stick it.
Tell you what, I'll write something up and we'll
Wherever you put it, it's fine.
yeah.
So section
Yeah.
3.
Especially with the ability to change with the county.
Okay, yeah, I made a note of that, and I'll wordsmith it somehow, and I'll have you guys look at it before it's final. So, any other discussion? Okay, that would take care of county coordination assessment exercise. County action plan. I do have a handout here. So I worked with Melissa and with the East Shore Industries staff, and we reviewed the table 5 from the previous plan, and came up with some action items. There were some that were deleted, but we continued on with several of the main ones here. First, we have continuing to monitor representation on the Kiwani County Transportation Coordinating Committee, or TCC, to make sure that it meets the needs of those served. Responsible parties are Kiwani County Human Services Department, Family and Community Services Unit Transportation staff. These are all going to be ongoing in terms of their implementation schedule from 2021 to 2025. And then we always have a roadblocks to implementation column. This says if changes or committee expansion are recommended, they need approval from the full county board. Is there anything on this action item that anybody would want to add, anything, delete? This has been kind of a main staple in the plans, I think, from the first one we did. Anything?
I think it's good. We've done a nice job of continuing to bring people into the committee, new providers, new consumers. I think there's a nice representation overall.
Okay, thank you. Next, we have continuing to update the county's transportation service inventory and update the transportation service resource guide as needed. And the responsible parties here are the County Human Service Department's Family and Community Services Unit transportation staff. Provides information to the Aging Disability Resource Center of the Lakeshore to be published. And roadblocks, we just mentioned that there will need to be outside assistance to keep this inventory updated. Anything needs to be tweaked here? Okay. Next, utilize Section 5310 program and submit applications for capital equipment, buses and vans as needed to replace existing fleets. We mentioned at this time, eligible service providers in Kiwani County, including East Shore Industries and the Kiwani County Human Services Department, are the main players with this. That's not to say down the road that there could be, communities that have transportation like we discussed earlier that would set up something, but at this point, those are the two eligible entities within the county. Roadblock, dependent upon continued receipt of Section 5310 funding, but I don't really see that going away at any point. It keeps being reauthorized in every set of federal transportation reauthorization legislation. So anything here?
Jeff, you just may want to add as a roadblock, we need to continue to have local match to support the purchase. Historically, we've had an abundance of funding in our trust fund for the transportation program, but we are beginning to deplete that because of the match for previous vehicles.
Okay. Depending upon having a local match. That phrased okay? Okay. Next, improved service convenience. We have Kiwani County Human Service Department Family and Community Services Unit transportation staff. No roadblocks that we see. Expanding the volunteer driver program. Again, Kiwani County Human Services Department Family and Community Services Unit transportation staff. And the one roadblock, need to continue to find qualified volunteers. Anything to be added here? The next to last item, provide transportation services to more children with disabilities. Again, Kiwani County Human Services Department Family and Community Services Unit transportation staff. And the roadblock we had here, services would be provided with the existing Section 8521 funding. Services would be provided using the same guidelines as the volunteer driver program. Melissa and I had kind of an email conversation about the paid nature of that particular driver, and we struck that at this time. It was in the 2016 plan as a paid driver. Anything on this at all? And then the last item, explore Section 5310 program options for operations, capital, and mobility management projects. Again, the same unit, Kiwani County Human Service Department Family and Community Services Unit transportation staff. And again, this would be dependent upon continued receipt of Section 5310 funding. You want to add the local match there too, Melissa, or no?
Yes, please.
And Jeff, I'm not sure, but that local match is really more for Melissa. Our local match is based off of our own board of directors.
Okay, who's talking?
This is Candy. I'm sorry, from East Shore.
Okay, yeah. Maybe I should add the words in the case of Kiwani County.
Yeah, I think that would be a good way to differentiate.
Is there anything that needs to be added or struck here? So you'll see the footnote here that the action plan is to be approved at today's meeting. So I guess we need, have to go through a motion, second, and approval of Table 5.
Do we have a motion?
I'll make a motion to accept Table 5, action plan summary.
I'll second the motion.
All in favor?
Aye.
Opposed? Motion carried.
With the amendments that we discussed on the two items. Okay. Anything else on Table 5? Now we'll talk about the Section 5310 projects, and I do have a handout for that. This is the last one you'll be getting. I'll try to enlarge this for those of you who are joining us remotely. We went through about 5 drafts of this as I put this together. So these are the capital projects that we're looking at through the Section 5310 program. So in fiscal 2021, which technically is October 1st, 2020 through September 30th of 2021, no applications for Kiwani County Human Services Department. East Shore Industries is looking at 1 site entry transit/bariatric vehicle with 6 ambulatory positions and 2 wheelchair positions at the cost of approximately $52,000. Any questions on 2021?
You're going for another bariatric? Oh, that's East, okay, I'm sorry.
Yeah. Fiscal 2022, neither Kiwani County Human Services Department nor East Shore Industries would have any applications for that year. Fiscal year 2023, which is October 1st, 2022 through September 30th of 2023. That's a pretty active year. Kiwani County Human Services Department would be looking at 1 dual axle gas powered minibus with 9 ambulatory positions and 2 wheelchair positions at the cost of, we said approximately $60,000. I think it was maybe 57, but we're inflating these in the out years somewhat. So that's why we bumped the cost up a little bit.
If I could just clarify, so that $60,000 is what we would be applying for grant funding for, and then the county would be responsible for the match, which I believe is 20%.
20% of 60,000.
And that's typically what we're digging into our trust fund for. So as we mentioned earlier with barriers, we have to look at what's left in that trust fund to determine whether or not financially it will be possible for us to move forward with that plan. And then part of the email correspondence that we were having was to find out if a CDL would be required for that larger vehicle, and it's determined it is not.
Yeah, I talked to Katie Patterson down at Wisdot in Madison, and she sent me an email. I think I forwarded it on. That, there's a threshold. I think it's 16 or more occupants of the vehicle, including the driver, is the threshold for CDL. So I think you're probably going to be okay. You know, if that were to be a problem later, we could certainly amend this plan and default to the other vehicle that we discussed. But try to get you guys on the better side in terms of vehicles and capacity and things like that. East Shore Industries, that particular year, fiscal 23, they'd have 1 gas-powered medium bus with 10 ambulatory positions and 2 wheelchair positions. We're costing that at about $66,000. Again, that was inflated over the base for 2021. So we've got that listed. Fiscal year 2024, neither Kiwani County Human Services Department nor East Shore Industries would have any applications for that fiscal year. Fiscal year 2025, Kiwani County Human Services Department, no applications. East Shore Industries, 1 new rear entry minivan with 4 ambulatory positions and 1 wheelchair position at the cost of approximately $46,000. Again, that was inflated over the 2021 listing that WISDOT gave us, for that year. Try to incorporate inflation here where we can. We have a footnote here. Applicant will continue to apply for listed projects if not funded in the year in which they are listed. And then anything else on any of the projects here, any adjustments, additions, deletions? Have anything, Candy, or look fine?
Everything looks fine on our end.
Okay. Anything on the county's end?
Yep, looks great. Thank you.
Okay. So I guess we need a motion and a second on table 6 as well.
Motion to approve the projects as listed in table 6.
I make a motion to approve.
Jean, a second.
I'll second.
Does it have to be a committee member, or are we?
I think it's more like a public meeting that.
Great. Dan, it is correct?
Yep.
Thank you. All in favor?
Aye.
Opposed? Motion carried. Thank you.
That's what I had on my end. We'll take all of your information back and draft the plan. At some point, maybe we can review it at a TCC meeting to make sure everything makes sense and that as well. But it's kind of what I had for today. I'd like to thank you all for your participation, and we'll take this back and get everything written and put together.
Thank you all for attending, and thank you, Jeff, for preparing this, as that was a big project, and certainly appreciate your guidance through the project. Before we depart, I just wanted to explore a meeting date for our next TCC, which, as I had mentioned earlier, will be a time in which we are going to be looking at the 8521 application. So it will be held in conjunction with the public hearing for that application. Ann Sullivan is a new transportation provider in the county, and she is interested in participating and being present for future meetings. She is unable to participate when we hold the meetings at 10 o'clock. And typically, Lori, you prefer to not meet before then, right? So I was wondering if like 11:30 might work on a Tuesday. How early can we go? Like 8 o'clock, okay? Does 8 o'clock work for the majority of people? Okay. The date I had looked at was Tuesday, November 17th, but I can be flexible with that date if needed. Yes.
Yeah, department head, I have that in here, so I don't know if that was a change or why I have that in here, but then November 17th is department.
And what time is that at? 9. Usually we're done within an hour, so should we try and do back to back?
Yeah, we can do it.
Okay. So we're looking at Tuesday, November 17th at 8 a.m.
Here, up here.
I'm not sure the location, but that'll be shared when the agenda comes out.
Are you saying that's the next meeting date?
Correct. I'm sorry?
I won't be here.
Should we look at an alternate Tuesday? Are you available generally on Tuesdays, Linda? Linda, are you generally available on Tuesdays?
I'm sorry?
Are you generally available on Tuesdays? That one just doesn't work?
Just that 17th.
Okay.
The 10th is county board, and the 24th is ADRC and aging.
What is county board in the evening?
Yep.
On the 10th? So could we do the morning of the 10th?
On the 10th is okay for me.
Okay. Does 8 o'clock on the 10th work for everybody? All right, we will plan for that. Any other questions, comments, feedback? Okay, thank you again for participating. Just going to be looking for a motion to adjourn.
So move.
I'll second that.
All in favor?
Aye.
Opposed? Sounds good. Thank you, everybody.
Thank you.
Oh, day.
Oh, I didn't contact him because I was kind of busy.